I started here at SASH back in January, so I've only been here for 6 months, coming just before the main peak in the second wave, so that was challenging in itself. But I dived headfirst into helping both non-clinical and clinical teams around the challenges that they face with COVID, and especially around processes that just weren't there. So one particular area that I focused on was patient property. Might sound a bit inane, but actually is so important to our patients in terms of their belongings, you know, to make them feel like they're at home, you know, some creature comforts that we all appreciate. So patient property usually depended on visitors to drop them off, but back in January we didn't have that luxury of visitors, unfortunately, due to infection control. So visitors would come in and they would drop the inpatient's belongings at reception, but what was happening is that it would just sit there and it would take a really long time for patients to receive their belongings. So what we did is I engaged with multiple different staff members from the States, the clinical team, etc., to really understand how we would deliver patients' property effectively and safely, but also on time. So what we did is we actually managed to employ an extra porter who was just dedicated, you could say like a postman, for example, who was just solely there to deliver patient property. So something that would take a really long time to deliver actually managed to be 10-15 minutes maximum, which is amazing for our patients. And it's really important for us because within that property would be their tablets, mobile phones, so they could connect with their loved ones, which through the really difficult time is so important for us. Sort of for me, thinking about the pandemic and all the negative connotations that can be associated with it, I mean, we've all gone through stresses and strains. You know, it's just, for me, there's been so many brilliant breakthroughs. I know I spoke about something that's so simple, but it means so much to patients to have their comfort with them, but also, you know, the fantastic work and support network that we've been able to develop here at SASH. I mean, for me, I've only been here for 6 months, coming in at possibly the hardest point that the hospital's ever been at. But I've had such a fantastic team. I mean, the KPO team have been fantastic in supporting me, making sure that I have what I need, making sure that I'm okay. But also not just the KPO team, it's the rest of the colleagues that I've been working with to establish such a fantastic process. Although I wish that the pandemic would end as soon as possible, I also think that we need to continue and strive and maintain those amazing things that we've been able to do, and be so proactive and give our patients as much value-added time as possible.
Things here at SASH.
Mind-blowing.
Months.
Shocking.